This is Austin with our Coach's Corner series, and today I want to talk about stretching. Now, a lot of coaches utilize stretching, and more common than not, we utilize static stretching, where you hold a position. So you like cross your arm over, get it to a point where you feel a stretch, and hold it this way, that way, whether it's like bending over, touching your toes, whatnot. A static stretch is usually utilized by coaches as a warm-up tool to limber up their athletes. So let's break that down and talk about maybe where it's appropriate, where it's not appropriate, what it's doing, and how to utilize it. A static stretch is a way of temporarily turning off your muscles. Your muscles have kind of two different states. They're either really excited or they can be really unexcited, depending on what's going on. And static stretching can work to unexcite certain muscles. Now, the reason someone might be tight in the first place has more to do with how their nervous system registers how well they move, what positions they're comfortable in, what postures they repeat, etc. But usually how I give it an analogy to my patients is, if you feel the need to stretch, like your hamstrings feel tight or your calves feel tight, a lot of the times I correlate that to like a scared nervous system. The nervous system doesn't feel comfortable with you going into that range of motion, and therefore kind of restricts it and keeps those muscles tight because it doesn't want you to go into that position. If you can't touch your toes, most people, after doing a couple of drills that don't have anything to do with stretching your hamstrings, but maybe learning how to hinge, how to offset your weight, how to expand through your hips, whatnot, will be able to touch their toes, and we never sat there and statically stretched. So if the reason you feel tight is because your nervous system is scared, stretching might not be the most beneficial thing to convince your nervous system not to be scared. But with athletes, sometimes we just do certain moves repetitiously and or stress certain muscles repetitiously to the point that they benefit from some static stretching. A cross-country runner and their calves is an example of someone who, probably should have a calf stretching routine because they just put their calves through so much work throughout the year. Now, a lot of coaches, a pretty antiquated way of programming would be to incorporate static stretching in your warm-up. Like you do some general dynamic warming up, you do some static stretching, and then you get into whatever your practice session or game for that day is. Now, if the goal of a warm-up is to excite things, turn on muscles, get them ready to perform, and static stretching turns down that dial and kind of turns stuff off, unexcites it, makes it loosen up and give way, those are kind of contradictory things. And so if you're a runner and you do a general 5-minute jog and then some dynamic warming up and then you finish off with some static stretching, you're actually reducing the excited level of your hamstrings, quads, glutes, calves, if you stretch to those, right before you're then asking them to perform in practice or meet. And so static stretching in and of itself might not be the most appropriate thing to do in a warm-up series. But for certain athletes who tend to overuse certain tissue, like the calves with a cross-country runner, there can be a benefit to, after practice, incorporating static stretching into your routine. Now, some guidelines for how you would do that have to be pretty stringent, because what we have found is static stretching's effect is pretty transient unless you do a lot of it, and it compounds on itself. And so the ideal dose or the ideal prescription to statically stretch is about 120 seconds at a time, 5 days a week for about 12 weeks to realistically start experiencing some genuine changes in your tissue where they actually start not being just all the time so tight. And then when you're stretching, the execution of it is just as important. You want to think of stretching as like a 0 to 10 discomfort level. You don't want to push all the way to a 10. So if you're stretching your muscles and you're kind of like holding your breath because you can't relax and the muscles seem to be tensing up around the joint and it seems really excruciating, that works to actually make your nervous system more afraid of that position and tighten up even more. Versus if you go into a stretch, let's say you're touching your toes, and when you start to experience like a 4 out of 10 discomfort, like you know the muscles being stretched, but you can still breathe and relax in the position, that's an ideal amount of tension during your stretch to let the nervous system calm down and relax. And ideally what you'll notice is after 15 to 30 seconds, commonly, the muscle relaxes a little bit. That initial tension that the muscle had kind of dissipates. And so after 30 seconds, what might have been a 5 out of 10 discomfort might go down to like a 3 or a 2 out of 10 discomfort. And what you want to do for that whole duration of the 120 seconds is as that discomfort goes down, you want to stretch further and get back to that 4 out of 10 discomfort level and stay with that barrier to actually help coax the nervous system into being more and more okay with added lengths on the muscle. So to recap, static stretching in and of itself, not the worst thing. Static stretching during a warm-up before practice or game or before exercising at a gym, probably not ideal, isn't achieving the goals or working towards the goals of a warm-up, which is to increase body temperature, excite and wake up muscles, and get tissue more elastic and pliable for what you're about to do. So if you are going to statically stretch, do it after your training, but also realize if you're going to statically stretch, you kind of got to be religious about it. If you're going to statically stretch your calves once a week, you probably could just not put the guilt on yourself and just not stretch at all, because unless it's done for about 5 times a week for 120 seconds a time for 12 weeks with that 4 to 6 out of 10 discomfort that you keep pushing to throughout the 120 seconds, you're probably just not going to make the changes in your tissue that you think you are.